Hello, everyone, and welcome to today's Rewire News Group event. I am Galina Espinoza, the President and Editor-in-Chief of Rewire News Group, and today I have the distinct privilege of talking with these incredible women who you see here, who are some of the leading global activists shaping the future of abortion access. I know we're all eager to jump into this conversation, but first, a few housekeeping items. We definitely want your questions. So if you have a question during this conversation for one of our panelists, please use the Q&A tab, which is in the bottom right corner if you scroll down of your screen. So it's not the chat function, it is the Q&A tab. You type your question in there and I'll be monitoring that throughout the conversation and trying to get to as many of your questions as I can. Of course, if I don't get to one of your questions, we are happy to share those questions with the panelists after the event to try to get you an answer. So take note of this email address, which is events@rewirenewsgroup.com. You can send your questions to us there after the event, and we will do our best to get an answer for you. That email, events@rewirenewsgroup.com, is also the email you should use if you have any issues at all during this conversation. We have a staffer on standby to assist you. So if you need help with anything at all, please do email us at events@rewirenewsgroup.com. All right, with that out of the way, I'm going to go ahead and introduce our panelists. And panelists, if you could just raise your hand when I am introducing you. First up, we have Rebeca Ramos Duarte, who is the Executive Director of Mexico's GIRE organization. In English, that is GIRE, and it stands for Group for Information on Reproductive Choice. It's a feminist organization in Mexico that applies a human rights perspective in its demand for reproductive justice. Rebeca is also a lawyer, and she was a parliamentary advisor and part of the working group for Mexico's constitutional reform effort on human rights. Welcome, Rebeca. Next up, we have Nelly Munyasa, who is the Executive Director of the Reproductive Health Network Kenya. This organization is comprised of healthcare professionals who are committed to comprehensive sexual and reproductive health and rights, advocacy, and service. Nelly herself is a trained healthcare professional. She is a midwife nurse. And so it's not surprising that she champions reproductive healthcare providers in all of the work that she does. Hello, Nelly. Marevic Parcon is calling in from 3 a.m. tomorrow in the Philippines, where she is the Executive Director of the Women's Global Network for Reproductive Rights, working to build and strengthen movements for sexual and reproductive health, rights, and justice. In her role, Marevic has implemented programs on women's rights, led the implementation of the Safe Abortion Advocacy Project, and established national networks to address abortion stigma. And finally, we have Mariela Belski, who is the Executive Director of Amnesty International Argentina. She is also the Argentina ambassador for the global advocacy group She Decides, as well as a human rights lawyer and an advocate in international human rights law. Mariela has spent more than 20 years working on issues involving human rights, gender, justice, and strategic litigation. And of course, we know that work is never done. Welcome, Mariela. So with all of that, let's go ahead and jump into the conversation. The first question I have for all of you is really an open-ended one. I'd appreciate it if each of you could go around and talk to us about, as you look at the year ahead, where are you focusing your energies? What are the opportunities and the goals that you want to achieve in 2021? And what are some of the biggest challenges that you face in achieving that? And Mariela, maybe you can start, because of course, Argentina had such a huge victory earlier this year. Yes, congratulations, when Argentina became the largest country in Latin America to legalize abortion. And when I was talking to Mariela yesterday, she said, and I asked her what comes next, she said, well, now it's all the litigation. So we know that the victory is one that will continue to be fought for in the months to come. So Mariela, talk us as you look about the year ahead. What do you see in store?
Well, thank you, Galina, and thank you for having me here. I will be very short for giving space to my colleagues. Of course, yes, it's litigation. Since the law was passed at the end of December, we already have more than 22 those lawsuits that are asking the most of them are asking the constitutionality of the law because of the violation of the right to life of the unborn. So we are concentrated in defend the law by litigation, and that is the most important things by now in relation to this law. And also the other part of our work is to try to put some pressure in our external relationship department, minister, in order for them to bring the criminalization and legalization issue in the region as an issue, as our country did in relation to the equal marriage law. It's not the same, it's quite tough, it's quite difficult. They are not so keen to do that, but we are trying. Those are our two most probably challenges, plus the implementation of the law, of course, to see how it's going in terms of implementation.
Absolutely. And Rebeca, are you seeing that influencing or impacting your work ahead, seeing what happened in Argentina?
Hi, first of all, thank you for having me. It's really a pleasure to share this conversation with this wonderful woman and to share what we are doing in Mexico. And of course, what happened on Argentina here in Mexico has had a huge impact in terms of inspiration and to think on new strategies and new ideas to get, you know, the legalization of abortion. But we know that it never ends, and it's very, very important not only to ensure the legal and social decriminalization. This social decriminalization that the Argentinians have done is amazing. We right now have a symbol with the green handkerchief, and also we're working on that issue, but also to ensure the access on legal abortion. We have in Mexico a mix of laws in terms of access. Here in Mexico City, we can get an abortion in the first trimester without any indication, but in the rest of Mexico, we have some different indications. Rape indication, for instance, is legal all over the country, but it is not the reality. You know, we have the law, but not every woman that needs or seek an abortion get the service. So we're working on legal and social decriminalization, but also to ensure the access to the service.
Yes, for sure. Access is a key part of the conversation wherever in the world you are, including here in the United States. Nelly, can you talk a little bit about how you're working with healthcare providers, in particular to ensure greater access for reproductive health care?
Thank you so much, Galina. And I mean, congratulations to Argentina. That was amazing, a milestone. I mean, and to the advocates that made it happen. We saw that women's rights are being respected and you're safeguarding, you know, the rights and rights of women and girls. So back to Kenya, the constitution is very clear. Article 26(4) says abortion can be provided when the health or the life of the mother is in danger. And this can be provided by a trained healthcare provider. And it goes ahead to, you know, clearly explain who a trained healthcare provider is. That is a nurse, midwife, doctor, a gynecologist, a clinician. So for us in our country, you know, and we also have the standards and guidelines that were reinstated back last year in 2019. And it stated very clearly that the healthcare providers have a responsibility to provide abortion services as provided for by the Constitution. So our focus as healthcare providers is advocacy, and our focus on advocacy starts right from the national level to the county level to the grassroots. And appreciating that we have a devolved health function, that means that some of the implementation of policies and guidelines lie at the devolved counties. So we are working together with the Center for Reproductive Rights, who have been very supportive in terms of just breaking down the laws, helping the Ministry of Health understand how the legal framework looks like in the country. We are focusing on ensuring that the Ministry of Health are held accountable for ensuring that policies are implemented right from the national level to the county level to the grassroots. We are also focusing on coalition building. For anything to go through, you have to be together as the key actors in the space, because as a single individual organization, then we make it easy for opposition to target us and, you know, ensure that we are losing on all the gains that we have made. So we are focusing on coming together as key actors in this space and ensure that we are working together to hold the policy makers accountable. And at the county level, we are working with both the government, that is the public facilities, and the private facilities. RHNK has a bigger network in the private facilities. The government, of course, manages the public. So we are bringing them together using the leadership in the counties to ensure that they understand what policies are available and what the Constitution says and how the legal framework looks like.
And, you know, you make an excellent point. Just getting information out is often one of the biggest challenges, especially when you're combating so much misinformation on these subjects. And Marevic, I know one of the big areas that you focus on is just combating stigma around abortion in the Philippines, which is a huge barrier to folks even realizing that this is an option for them. Can you talk a little bit about how you're prioritizing that work this year?
Yes, thank you, and my pleasure to be part of this conversation. And yeah, I mean, congratulations, of course, to Argentina. And the biggest for me, the opportunity working in a restrictive settings like we are in the Philippines. As you know, abortion is highly restricted here. A woman can be put into jail for 6 years for having an abortion, and there's no legal window whatsoever. So it is actually also, for me, the opportunity working in this context is really having that inspiration right now from the recent successes, and that inspires us to work to continue the work that we do. And we've seen the successes during the pandemic period, and I would just really draw back to that one because I'm very much inspired with how women's rights movements and activists continue to fight during in the middle of the pandemic. And we've seen this, of course, like we already have mentioned, in Argentina. We've also seen this in South Korea, in Thailand, and all those advances that we've seen right now. And this inspired us in where I am right now, and in a very restrictive country. And we launched our own decriminalization of abortion campaign as well in 2020, bringing all those experiences coming from others, drawing the inspirations from others. And that for me is that whole opportunity to learn from each other is one of the biggest opportunity. And, you know, we are in an exciting times, and whilst learning from the successes, we're also faced with lots and lots of regressions on abortion rights advocacy everywhere. And both are opportunities as well to be more innovative on what we are doing, to be more creative. And that actually already in facing stigma in the country, we are doing a lot of information work. We are normalizing the conversation. We've managed to do a lot of work around online work, of course, during the pandemic that draw many in the Philippines, why there's the need to prevent unsafe abortion from happening. There's 3 women die each day in the Philippines due to unsafe abortion, and 3 women is a big number. 1 is big enough, right? So for us, we have been very, very creative in doing our work during this period. And I cannot underscore enough that the recent successes and even the regression also inspired us to do the work that we do. And we continued online work. We continued our work in mainstreaming the issue, so to speak. We have to, you know, and if the opposition is mobilizing, we are also mobilizing. We are facing them, the opposition, with facts, with data, and we're doing the research work around this. We're also doing a lot of community outreach, a bit, of course, in a very limited way that we can during the lockdown period. And we are still in a lockdown period in the Philippines. We are the longest in the whole world right now. Well, they made use of this whole pandemic to justify the repressions that is going on. And there's, during the pandemic as well, with sexual and reproductive health services happening to women. And there are already 2 women who died due to the refusal of care. So those are the things that we're facing in the midst of the pandemic, but we push back. You know, we are continuing with our work. We've been so creative. We are so inspired, and we have that vast of experience from our colleagues, from our compañeras from Latin America, from our colleagues in Thailand and South Korea, and so many other countries. Yeah.
And Marevic, you talked about the regressions that we've seen in the last couple of years, and certainly that's been true in the United States, which is why it is so inspiring to us to see the successes that are happening in other parts of the world. But I do want to ask, and it's our first audience question as well, about how U.S. policies have impacted the work that you're doing, because we know that's an added challenge in trying to move forward. And Nelly, you and I, when we were talking yesterday, you talked about how yet another thing you have to explain to your, to folks who come in seeking services is, oh, there was this law change in the United States that is now going to affect what you can and cannot have for your healthcare. Can you talk a little bit about that impact?
And Galina, it's not only the patients and women and girls who come in and they couldn't get services. We're also talking about our providers. They couldn't understand why we suddenly stopped training them, like updating them, providing for them updates on the different current methods on provision of safe and legal abortion services, why we stopped even taking the outreaches in the communities. One thing we appreciate about Kenya is the communities stay far away from the healthcare facilities. So with the fund that we got from the US government, we will take the outreaches in the communities. We will take the services right close to where the women and girls live. We had to stop that. And our providers could not understand why. And we had to sit them down and tell them there's this policy that has been put in place in the United States. And unless we signed on to it, we are not receiving funding. And we saw that this affected, a broader aspect of SRHR service and not only abortion. And given that we were an organization that provides abortion services and we refused to sign on to the global gag rule, that means that we were not going to access HIV, TB, cancer screening, contraceptives. We were not going to access that funding. So that means that patients that had HIV and dependent on our providers to access those services did not access those services. There's something else that we realized that happened very fast between 2017, 2018, 19, it had really picked up. We saw a lot of opposition coming together, organized, and attacking abortion organizations. And we quickly thought in the past years, they were very quiet. We, yes, knew there was opposition, but they were not loud and strong. This time we realized they were putting billboards strategically in town. They were attacking healthcare providers. One point in time, they had to go, just before ICPD, they went to one of our providers' facility right at the center in Nairobi. And they didn't know the provider, but they knew that they had the provider's name. So we've seen a lot of attack on sexual and reproductive health. We've seen a lot of attack on providers. And this, we strongly believe that they probably got the funding that we said no to. Something else is, it was hard for us to get into spaces with other partners, especially those that had signed on to the global gag rule, because there was not going to be any association with the organization if it provided services. And we totally understood they needed to protect their funding. And so above all, of course, then funding opportunities really for abortions, for organizations that provided safe and legal abortion services really shrunk. I can tell you that some of us have survived with very minimal funding. And this is because the organizations or the countries that were now opening up to provide safe abortion funding were very few, and organizations that are doing this work, be it service delivery or advocacy, they were really many. So the only thing that then came to that saved us was the She Decides movement that was then started immediately by Lillian Plumen. And we quickly, got alternate funding that supported us for 3 years. But when you look at the amount of funding that we lost through Planned Parenthood Global was way a lot. We couldn't continue with some of the activities that we were doing in the communities. So really the harm was big, and I'm sure that it's going to take a while before, we normalize, we go back to our normal, access to funding the way it was. However, with the advocacy and coalition building that I talked to during my introduction, I think we're going to make bigger strides, and we'll continue supporting women and girls back in Kenya and also across the region, because I'm sure that some of the effects, challenges that we faced as Kenya, they were across other regional countries in Africa also faced similar challenges.
Rebeca, I see you nodding throughout Nelly's comments. I would love to hear how kind of US policy has impacted not just the work that you're doing, but even just the perception of reproductive health care as you're trying to fight for it as a human rights issue.
Yeah, I was noting because in terms of the negative perception, but also the opposition strategies and activities here in Mexico. When we see something happen in the States, like the personhood loss, we know that in some months or the next year we're having this kind of conversation. And right now, for instance, just 2 days ago, we have a discussion on one of Mexican states, Quintana Roo, where is Cancun, and there was a discussion of a bill to decriminalization abortion. And it was amazing how the congressman and the congresswoman was using these arguments that the opposite groups in the States, but also here in Mexico and in the region, have used in terms of obstacle the abortions, the abortion access. They were saying that this constitution, Mexican constitution, and also the Inter-American Convent says that it is a person since the moment of conception, and they can't eliminate the crime of abortion for their criminal code. So it is amazing how the opposition and the anti-movement groups are using the same arguments, but also and I was listening, Nelly, in terms that it is not just an obstacle for abortion access, but for reproductive and sexual services. And this is terrible. Here in Mexico, for instance, nowadays with the pandemic, we have a huge level rate of maternal mortality, for instance. And of course that the COVID-19 emergency has a lot of to do with this situation, but also this negative perception in terms of providing reproductive and obstetric health for women. So what happened in the States, it applies directly to us, and I think that it is very, very important to share these kind of spaces and share information and strategies to avoid these terrible consequences that has that kind of those kind of strategies against human rights, but also reproductive and sexual rights.
Yes, and in the spirit of sharing strategies, Mariela, everyone wants to know, given all of the stigma, the disinformation, the lack of support, how did you achieve this momentous result? How did you finally push this through? What would you say was key to the success of this grassroots movement?
Well, first of all, I will say that the women's movement in Argentina has been fighting for this for years and years and years. So this was a very, very long fight. I would say that the experience of 2018, when the law wasn't passed, was very important, because until 2018, the issue of abortion wasn't in the public agenda, and was that year, even though we lost it, was the year where the issue started to be in every place, in every house, in every family conversation, in schools. the young people took this cause as their own. That was very important. Young people are those who are going to vote, you know, in the next election. So that is a very important issue. The actresses and actors took that cause as their own as well. So all these influencer things helps a lot, because until 2018, were we just the human rights movement and the women's movement. The national campaigns, the national campaign that is an umbrella organization made by a lot of different groups was key. How we organize ourselves, the value added of every organization to do lobby, to speak to the general people, to bring creative things, you know. I should say that at least from Amnesty ourselves, I think we really spent a lot of time thinking original and innovative issues to do in relation to this, in order to put the subject on the agenda, to maintain the subject on the agenda, to press on the president to fulfill his compromise of debating abortion during 2020. We did a lot on that. And I think all this was very important for us to have this law passed. I would say also that, and I need to be very sincere, of course, this is a win of the women's movement, but the political side of our political side of the country did a lot. You cannot have these laws passed without the compromise and the fulfillment compromise of the president, the executive power, and the majority of his party, who is the majority of the Congress. And this is why we didn't have the law passed in 2018, because at that moment, the president, the former president, when he said, I will allow this debate to occur, but I will you to know that I'm in favor of the right to life. That's why we lost in 2018. So it's the women's movement, the pressure, the international pressure, the power of the movement, plus some political movements there.
Yes. Well, you've called out something very important, which is that you need a lot of different allies. And one of the things I love about our Rewire News Group community is that everyone is always looking for how we can support other folks working in the space. And in fact, one of our questions comes from someone asking, how can folks who support reproductive rights here in the United States, what can we do to support and amplify this work that is happening around the world? And Marevic, I'd love for you to start with an answer for that. You know, what would be on your wish list? How can we help you as you fight abortion stigma in the Philippines?
Well, we are, as WGNR, we're working globally as well. So not only in the Philippines, but we have, I don't know if you've heard, but we've also adapted the September 28th that comes from the Latin American colleagues as well. And we globalize this, and now it's being called International Safe Abortion Day every September 28th, where every year we have innovative, activities, campaigns that we've seen wide and growing mobilizations, including rallies all over the world, marches, conferences, cultural performances, arts-based interventions, etc. And I think this is, this is the opportune time for every one of us to really, support these kinds of work that comes from the community, from the grassroots community themselves. I mean, the global movement, the growing global movement for safe abortion rights is actually driven from the global south. This came from the Latin American colleagues. This also, spread throughout, and there are already organically movement in countries that is being driven by grassroots communities that is not being supported. I mean, Nelly have already underscored a lot about the funding crisis, and that is also the same in my context, the same in many other contexts when there's that global gag rule, even in my country where there's no, in our legal system, in our health system, we cannot access safe abortion legally. That has been affected by the global gag rule because there's the shrinking of, resources for the broad SRHR work, including abortion advocacy work that does not even, right now have the capacity to provide abortion services in countries where it is restricted. So I think one of the role of everyone is really to support this initiative, and there are lots of ways to do that. There are movements out there that is very vibrant. In the US, it also there's reproductive justice networks that are really working towards, talking about abortion rights in a justice perspective, not only about, having that ability to choose whether or not to continue the pregnancy is not present, because there's no such thing as choice in a country where there's no services. So I think in that sense, one of the things that we can actually do together as abortion rights activists all over is that we will be working in solidarity. We're working and that's my biggest takeaway, Mariela, in the Argentinian case. My biggest takeaway is that you were working in solidarity with other political and other sectors, and the bad way to work is actually really working in isolation. We know that we're working in siloed for so long, and this is the biggest lesson that we get from the Argentinian experience. Make it big, make it wide, make sure that we can sustain our work, that it is part of the wider social movement for demanding for social justice, and that is us as a community of this work, as a movement of this work from all over. And we have in Asia, we have a SAGE, a Global South Initiative for abortion rights, which I am part of the advisory committee as well. There is, of course, WGNR. In Africa, we also established She Acts Africa, a grassroots-led network that's really working at the grassroots level. When I say grassroots level, it's really a community initiative that talks about the taboos, that talks about stigma, that talks about abortion and the lack of it, the abortion services and the lack of it. Yeah, so lots of work, and our work is not, and we are in this for a long haul, I would say.
And it seems that one of the biggest taboos still after all this time is often just convincing people that abortion is safe, that it is a medically safe procedure. And Nelly, we have a question specifically for you from someone from Kenya who says, how do you, when you work with providers and policymakers, how do you convince them that it is possible to have a safe abortion? And he makes reference to a recent case where a father lost his daughter in a botched backstreet abortion in a town that I will try to pronounce, Kakamega, I think it's, and close enough. And so clearly when things like that happen, it does have an impact on the message you're trying to get out to communities. So how do you reinforce the idea that this is a safe medical procedure?
Yeah, so when we talk about unsafe abortion in Kenya, sadly, we continue to see a lot of unsafe abortions. And research that was done by APHRC some few years ago showed that 7 women and girls die every day due to unsafe abortion. And I think abortion stigma, and Marevic has really talked about it, has contributed to access to safe and legal abortion services. So what we do as an organization and as a network of providers, just to try and make sure amidst all the challenges that we face, because for us to provide this information to reach the consumers or the beneficiaries of these services, we definitely need funding. So we try to engage at the grassroots, at the community. We engage with the gatekeepers, at the religious leaders and the groups of women and young people in community dialogues. And during these community dialogues, we bring on board a lawyer, and more importantly, from the Center for Reproductive Rights, who we work very closely with, to be able to break the law as it is. And our providers, we work with provider advocates in the community who, in Kenya, healthcare providers are quite respected people. So what we do, we bring a provider from the same community to speak to them about abortion, to speak to them about dangers of accessing, going to quacks, for example, untrained, unskilled healthcare providers for services. We also are using young people as champions and advocates in the communities. When we look at data that is collected at Reproductive Health Network Kenya, a lot of people that are accessing these services are adolescents and youth. So we use them to ensure that this information is reaching out to the young people. We engage them on online platforms and also offline. In the communities, we train them, build their capacity, provide them with information so that they're providing the right information in terms of what the law says and where they can access these services. So they act as our linkages from the community to the providers, and also do follow-ups for women and girls who have accessed services from our providers. Then finally, what we've also done, and this was during COVID when we realized that due to the restrictions, the cost that came with COVID-19, women and girls were not able to access services. So we developed Nena na Binti hotline, which is confidential and non-judgmental hotline where women and girls can call in and in need of safe abortion services, and broadly other SRHR issues. And we provide them with pills. If they need abortion pills, we are able to deliver to them at the comfort of their homes. And we link them up to a healthcare provider who takes them through the whole process and ensure that the procedure is successful. For those who need facility-based services, then we link them up to our providers across the country. However, the challenge is we have not been able to, cover the whole country as much as we would have wanted due to financial constraints. But that is basically what we are doing, just trying to engage right from the grassroots, the policymakers, religious leaders, gatekeepers, women and girls forums, trying to penetrate everywhere so that we are not seeing women die as it has just been indicated by Robert. Yeah.
One of the recurring themes that's in all of these answers is the importance of connections, of linkages. And we have an audience question that, Mariela, I'd love for you to address. What about forming connections between kind of these big topics and issues that are interconnected, that are part of the reproductive justice movement? So working in the US, for example, activists are working to connect abortion with gender-based violence, with LGBTQ rights. How do we integrate these all together as part of the broader gender justice movement?
Well, in Argentina, abortion was the way to connect all of this group, because the LGBTQ plus group was very involved. The movement that was fighting for violence against women, of course, was the same movement. Was not the same, not exactly the same, but part of the movement who was dealing with abortion as well. Of course, abortion is quite difficult in some terms, because violence against women, you can find that those who are against abortion are in favor of fighting for violence against women. So there is no you don't find a difference there. So I would say that violence against women is another issue, but of course, in abortion, the LGBT group was very important. I think that as Nelly was saying, the young people are those who I think in Argentina make really that difference. When the government saw that such amount of young people were in the streets, in the demonstrations, they started to think this is serious. So I think that is a very good one, to try to bring young people to the cause. And of course, as you said, this needs to be worked, and as Marevic said, in a networking way. You cannot do this by your own, and you need patience. It's a long time. You need to lose first, but you are going to win then, as it happens here. It's not an easy way to go. And in the middle, you have a lot of things to do. The main and most important issue is to maintain the subject on the agenda all the time, no matter what. We as Amnesty last year had abortion in our everyday work, everyday need, social network, everyday communication, because we wanted the debate to happen during 2020, because this is an election year and no debate is going to happen in an election year. And I would like to say something else. We have been very inspired by US, unfortunately. I say unfortunately because where you are now, but we started and we learned from you. I mean, we learned from Gloria Steinman. I mean, we learned from you, honestly. from Roe's Wade. So it's interesting, no? What you are living now, because we use a lot of what you use in order to be where we are now.
Interesting is definitely a word for what we are living through right now. But of course, we do have a new president. And I know that many folks have a lot of high hopes for the new administration. One aspect of the Biden administration that I think is interesting is that because Joe Biden is Catholic, it's sparking a lot of conversation here around the intersection of faith and abortion. And Rebeca, I'm curious, Mexico as a predominantly Catholic country, how does this play out in your conversations? And what can we expect as part of the conversations we're embarking on?
Well, right now here in Mexico, yeah, we have a huge part of the population that is Catholic, but also in the last years, it has been a race of evangelic and Christians religion. Something that we have seen is that they share the high levels of Catholic church, but also the evangelic churches share their opposition against abortion. But what happened and what we have been working a lot as feminist movement is to take the non-religious characteristic of our state, the non-religious,
yeah.
Exactly, the non-secularism. And also there has been a great job, for instance, like Catholics for Católicas por el derecho, for right to choice. For choice. Catholics for choice, sorry. Thank you, Mariela. Catholics for choice, that they have working here in Mexico for more than 30 years, working on the basis of the Catholics and telling them that it is a thing that has to be with the free choice, with the free will of the women, that they are not sinners. The stigma around this party is so heavy and tough for women. But what we have seen since 2007 with the legalization here in Mexico City is that women, when we have abortion as a legal service, it is also, we also have a social change. Women here in the city, women who came from the States, have a different approach to the service, like a right, not like a sin, not like a favor for the health institution. So I think that it is very, very important for us here in Mexico to acknowledge that this is a public thing, that you can be against abortion, but your obligation as a state, as an authority, as a medical provider, is to fulfill the rights of a woman, and abortion has to be related with right to health, to right to life, to right to autonomy. So we have working here with these arguments, but also I share with Mariela, Marevic, and Nelly about the importance of the young people. Has been amazing, the force and the inspiring, and how the new generations have a completely different idea of what abortion is. And that abortion, it is related with rights and to reproductive justice, to justice. So I think that right now we have a huge opportunity to change things, even though the obstacles are there and the opposite forces are there. But with young people, I'm quite sure that we're going to get a great achievement in the next years.
It is truly inspiring to see young people raising their voice and driving this change in so many places. Of course, we saw recently in Poland a huge step back with their near total abortion ban. That was really devastating to see how that all played out. And someone from our audience is asking, how can we help Poland move forwards instead of backwards? How do you, if you are, living under that kind of situation now, how do you start to fight for change? And Marevic, because I know that you also, live in are working in a similar kind of environment, if you could talk to grassroots leaders in Poland right now, what would you say to encourage and inspire them?
Well, we are in similar situation. The opposition here is so strong. We haven't felt them yet after we came out with the decriminalization of abortion proposed legislation last year. But we are readying ourselves as well that they're just being quiet right now, looking, having a look-see situation, how strong we are. And I think one of the things that I can, if I have that opportunity, if I am that in.
Oh no, it looks like we may have lost Marevic. I know that she will log back on, so we will let her finish her answer when she's able to rejoin us. But I'll take another question from the audience, which is about, I'm sorry, Marevic, we lost you there for a moment.
Yes, I thought I was just talking. I really thought I am still on, but yeah, I mentioned that if I have that opportunity to speak with the Polish colleagues, I would really say that the whole importance of the grassroots mobilization, the critical mass of support for our work, and we've seen this in their mobilizations right now. There's a lot of people right out in the streets, working, supporting abortion rights in Poland. It's an opportunity. It's a huge opportunity and an inspiration. I mean, the victory is not only at the legal, system, but if the legal system sees that there's that huge push coming from the ground, coming from the community, coming from the electoral people, the people who vote, the people who votes, then for abortion rights right now. I mean, we've seen the peasant communities marching in the streets in Poland right now, and we've seen that in the news that it's actually very intersectional, that what they are doing right now. And so I am not in the position to actually right now, have that advice to them, but I would just say that it actually is, inspiring to see that the victory for us feminists is not only the be all and end all for us, is not at the legal system itself, but the power of the people that actually mobilizing in support of the work that we do.
I think that's a great message. Thank you, Marevic. Speaking of new things that are changing the landscape, medication abortion, we certainly expect that to have a dramatic effect on the conversation here in the United States. Nelly, I would love to hear from you. Is this something that is part of the conversation in Kenya right now? And what impact do you think it could potentially have?
I think on the contrary, medical abortion is the most preferred by women and girls in Kenya, compared to the surgical option. And this is because it is, less traumatizing. You take your pill at the comfort of your home, and then everything else happens. So for us, what we've seen over the years, even for our providers, as we train them, take them through the different options of providing safe abortion services, most of the data we are receiving is on medical abortion. Most women and girls prefer medical abortion, and then unless for the second trimester, and then for the second trimester, of course, then definitely we have to provide a bit of medical and then surgical. But most of the girls and women are comfortable, even the healthcare providers. So it's not an issue of, it's not something that is being discussed. It's not something that is bringing issues in country. And that's why it's even easy for us to, encourage self-managed abortion, because they can access the pills. It's just that they're costly. Accessing them from the pharmacy or the chemist, they're a bit costly, but they are available and they're the most preferred.
Mariela, do you see medication abortion affecting the conversation or policy there in Argentina?
Yes, in Argentina, it's allowed to use misoprostol. I don't know if the same is the same
Yes.
name in everywhere,
Yes,
but
yes.
and it was approved for this use because it wasn't until some years ago, and now the government says that they are going to produce it, so it's going to be available for everyone, and of course, well, Nelly can say that better than me. I'm a lawyer, but of course, misoprostol helps a lot. Misoprostol and mifepristona. Mifepristona is not allowed to be used here in Argentina, but the combination of both, of course, are a great way to have an abortion in a very safe way and not go into a hospital and those things. With misoprostol, sometimes works, sometimes it doesn't work. You need to end up in a hospital. But before we have this law, of course, what we had was a lot of clandestine abortion, a lot of clandestine sale of this misoprostol with very high price. Now that the government is going to produce it, it's going to be very accessible to everyone. I would say that in a way the law it's put like in an equal place everyone, you know, like not only because those who are from most disadvantaged classes were those who most suffer the lack of the possibility to access to abortion, and those who got in a better position, of course, they were paying for that in a clandestine way. So now this law puts every one of us in the middle, in the same place for accessing it.
Great. Yes. No. And I think here in the United States, you know, we're waiting to see how this is all going to play out, but the hope is that it does improve access across the board and make it, you know, just a safer, more accessible procedure for women and for anyone seeking an abortion. So I want to be mindful of time. And as we're coming to a close, I want to give you each a chance to leave our listeners here today, our attendees, with one final thought about the work that you're doing. You know, if there is one thing for us to know here in the United States about the work that you're doing in the communities, what would you like that to be? So I'll start with you, Rebeca. What would you like folks to remember about what is happening in Mexico in the fight for reproductive rights?
Well, I would say that we are so inspired for everything that is happening in the region, in the world, and even though the context is not the best for getting the legalization of abortion, the force of the social movement, the feminist movement is huge, and we're fighting for our rights. So we are. You are here. You will hearing about us very much.
Well, we look forward to hearing lots of good news, we hope. Nelly, what would you like folks to remember about the work that you're leading in Kenya?
Grassroots organizations know what they're doing. They are in touch with women and girls who are most of the time denied access to what we deem right, the sexual and reproductive health information and services. So we want to support our work, to make our work, you know, to support women and girls, to build women, to give them voices. We want to amplify the voices of women right from the grassroots so that they can tell their story because they've lived this, they have been part of this. So we want, for example, the mainstream donors to trust locally led grassroots organizations that are also globally connected.
Wonderful. Marevic, what about in the Philippines? What is the takeaway that we should remember about what's happening there?
Yes, well, the work didn't stop even during the pandemic. We know this for a fact. What it taught us is that we became more creative, more active, more innovative in what we do. So you will hear more about the Philippine Safe Abortion Advocacy Network's work in the Philippines to legalize abortion, and in the coming weeks and months and years. We know that this is going to be a long struggle for Filipino women and people who can get pregnant in the Philippines. We are aware of that, and we need your support to continue our work. We cannot underscore enough about the support during the campaigns. We also have change.org petition that you can look up. I can send it to Rewire, tag Rewire about that. We need your support internationally, that in this context that we are in right now, we are militarized politically, we are repressed, activists are being there's activists, there's arresting activists, but we persist also, that because movement for change and investing in young people is a must in this work. And in the coming months as well, we are going to come up with arts-based work. Right now we're doing a hip-hop album that could, really, the young people here are in the forefront. They are so, they are the ones engaging the opposition in defending the proposed legislation of the Philippine Safe Abortion Advocacy Network. We need more young people, and we need your support for us to be able to capacitate young people.
Yes, I love hearing about the persistence, the energy and the optimism that you all bring to this is truly incredible. And Mariela, speaking of inspiration, you've heard everyone on this panel, everyone in our audience has been inspired by the work in Argentina. So how are you going to keep inspiring as we move forward?
Well, I would say three things. One, for us, of course, you are going to hear our fight for the implementation. Are you going to hear our fight to those who are getting here from the States, from every place, the evangelists, the Catholic movement, who is here with more presence because they want this they want this law to be unconstitutional, and the movement that is against the legalization and decriminalization of abortion has grown in 2 years, as you cannot imagine. So we have them there to fight with, because they are there, not to fight, but to manage, to know they are there. And of course, litigation is going to be important, to get to court and to have a final decision in the Supreme Court saying abortion is legal in Argentina, and that's it. So the litigation issue is going to get there. Then where they are going to litigate other things, but not that unconstitutionally of the law. And of course, to bring our lessons learned to everywhere, to have this kind of dialogue and to share our experience and our campaigns and our thoughts and strategies. This is the best we can do, to share with everyone. We are doing this, for example, now with Germany. Germany is having a bad time in relation to abortion, and they are looking to us, or Poland, as you said, in order to see what we did here in order to the law to be passed, because this is also the country of Francis, Pope Francis, no? So that is an important thing. Yes. You should think that the abortion was passed in the country of the Francis Pope. Yes. That must inspire you.
Well, clearly this is a conversation that is vital to keep going. And to that end, as we wrap up here, I wanted to remind everyone that if you have a question you'd like one of our panelists to answer, please do email us at events@rewirenewsgroup.com. We will also be following up with all of you attendees today to share additional information about our panelists and their work, including some folks have asked how you can help support them in different ways. And of course, we hope that you will continue to support Rewire News Group, whether that's following us on one of our platforms, Twitter, Facebook, Instagram, YouTube, you name it, or donating through our donation page. We are all part of this conversation and ensuring that folks have the information they need to fight for the health care that they deserve. So thank you to all of our amazing panelists. Thank you to everyone for attending. And we hope to see you at our next event, which we will be emailing you about soon enough. Thank you. Wonderful to connect with you all. Goodbye.
Bye.